So the phrase discs is something that I think a lot of people are scared about, and I want to explain what a disc is and how it can affect the pain that you might get from it and what we can do to help it. So you all have discs within your spine. That's the vertebra. Below it, sandwiched between the next vertebra, is a disc. You see the slightly squidgy toothpaste type sort of consistency stuff. So this is an example as to what a disc might look like when it's protruding. It can actually move in a number of orientations. So you can see it actually physically sticks out, and clearly sticking out it can pinch and push on a number of structures, most commonly the nerve that exits at that level. Now it doesn't pop out, it sort of squidges out, and it doesn't all completely leave, but they're fairly sort of stiff structures. So local pain, yes, you will get local pain at the low back area, but more importantly, disc-related problems are notorious for giving you buttock and leg pain depending on the level that you actually got irritated. So the lower down the back you have, down to here to L5, you actually get pain right into the foot. And with that you often get tingling and numbness and a loss of strength as well. So that really classifies it as a disc problem. So like all other problems, there are stages, and the early stages of disc problems just give you a moderate amount of pain with the leg symptoms as well, and obviously as it progresses the symptoms get more and more painful, up to the point where it gets really quite serious and possibly surgical intervention is required. So what can a chiropractor do? First thing is to deal with this problem early. So if you find that you've got back pain and leg-related symptoms, it's worth seeing someone as soon as possible to see what can be done and catch it and nip it in the bud. So you get localised pain and numbness into the back and down the leg. So what we would do is, obviously once we've established we've got a disc problem for which there are specific tests and medical examinations that we can run, what we try and do is take the pressure off this nerve and re-establish the blood supply and nerve supply down the leg, and thereby that centralises the low back pain, takes the pressure off the leg, and the disc recovers. In early stages that can be done fairly easily. Obviously as the problem progresses and the disc becomes more and more protruded, it's more difficult to have it return to normal function. So again we go back to the vertebral column and we will work on the facet joints at the level where the disc is protruded and try and improve that whole movement of that segment and take the pressure off the disc as such, and that can be quite beneficial and quite quickly relieving the pain, and that will also relieve the pain down the leg. Now if that's too acute in that area, there are a number of things that we can do which involve sort of tractional type exercises and treatments to the leg which will take the pressure off the nerve at that level. Obviously soft tissue work and massage really help to take the pressure off from that level as well as ice packs and general relieving of postural incorrectnesses.